We spend twice what other high-income nations do on health care, but we have the lowest life expectancy and the highest infant mortality rate. It's a new study that was just out. And it's not doctors and the hospitals that are at issue here. Maybe higher here because prices are steep for drugs, medical devices, physician and nurses' salaries, and here's the corker, administrative costs. And this thing is totally out of control. It's been out of control. Like I said, we tried the federal mandate way. That didn't work. Now we've got an election year coming up. You know this thing isn't going to change appreciably between now and November because nobody wants to touch what has become this third rail. Where do we go? How does it get fixed? Seth Denson is an insurance expert. He's got his own company, founded his own company, GDP Advisors. And my guess is has some really strong thoughts about where health insurance is in this country right now. Seth Denson, welcome to 700 WLW. How are you?
Ken, thanks for having me on. I'm doing well. Appreciate it.
This is like that 900-pound Sasquatch that nobody can seem to rope and bring to the ground. I speak of the healthcare industry in this country, and I don't think it's getting better. Is it?
You know, it's really not, and it's the 900-pound Sasquatch, but it's getting bigger every year. It's the largest single piece of the American economy, and it just continues to grow each and every year. And as we look at it, it's not getting better, nor is the horizon that it will get better, at least in the way that we're approaching the problem in and of itself.
And Obamacare, which I guess dates back to 2010, we're beginning to feel the ramifications of that, right? I mean, in some states, the premiums that people have to pay are just sky high. Arizona comes immediately to mind, but there are others I know. That's not going away soon, is it?
It's not. Matter of fact, a recent article over the weekend I read said that Obamacare premiums nationally could increase as much as 90% over the next few years. And, you know, as we look at it, the big issue with the Affordable Care Act, well, there's multiple issues, but the biggest issue is that it singularly tried to address health insurance. And the problem is, and this is almost so simple that people just miss it, health insurance it's just healthcare financing. That's really all it is. So unless you do something to address the increasing cost of health care, the financing mechanism, which is insurance, is only going to continue to go up.
Right. And, you know, I'm not one of those people that think that this thing was Armageddon, it was evil and all that. At least they tried. You might not have agreed with what the outcome was or what the actual setup was, but at least they tried. I don't think the current group that's in Washington really wants to put their arms around this thing, be them Democrats or Republicans, and particularly in 2018 when you have an election coming up. I don't think either side wants to get into a healthcare debate between now and next January.
Sadly, you're right. I think what we're seeing out of Washington right now is more of a desire to win than there is a desire to improve or impact. And when you have that conflict, the ability to move the needle forward really is very, very difficult. And the issue that we constantly are seeing in the healthcare marketplace is we have this area of conflict between capitalism and care, right? I mean, I am a capitalist. As you mentioned earlier, I started my own firm. I love our economic system here in the United States, but the hurdle is, especially when it's related to health care, is you do have this conflict that the ability for one to earn a dollar is in conflict with my desire to try to make sure that people are cared for in an effective and efficient manner. And right now, the way that the healthcare system works in the United States, the largest conglomerates, hospitals and providers and insurance companies, are rewarded based on how the pricing model is structured. And so because of that, we see their stocks at an all-time high. Matter of fact, the average stock price since the passage of the Affordable Care Act for the largest health insurance companies has more than doubled. I mean, we're up over 200%. So when you factor that in, and then you get into the other side of it, I'm also not big on government regulation, but this is one of those areas that unless something changed from a regulatory standpoint and we put our heads together and solve this thing, the wheels are just going to keep on turning, and that 900-pound Sasquatch will become a 1,200-pound one before we know it.
You know, I'm old enough to remember when hospitals were not profit centers, when they were owned by churches or doctors' groups. Is the root of all this, and look, I'm with you. Capitalism is my game too. But is the root of this not when hospitals became profit centers and all of a sudden, instead of having relatively fixed costs for things that you needed to attend to medically, they became games that were played between doctors and hospitals and insurance companies?
That's exactly right. I used to refer to the system as a three-legged stool with providers, patients, and payers, and now I consider it a three-headed cannibalistic dragon because it just continues to feed off of itself. But the biggest driver, if you strip away everything, and there's a number of things that are driving increases in cost in the world that we're in now, but the biggest driver, I believe, is a lack of transparency and the fee-for-service model that we're in. Right now, the system is rewarded based on the number of services provided rather than the overall outcomes of those services that are rendered.
You sound like a level-headed guy. I know you're from Texas. I think people may want to get a hold of you and talk to you. How do they find you, Seth?
You know, best way is our website, gdpadvisors.com. We have clients throughout the country, but, gdpadvisors.com is the best way, and we would love to visit with anybody.
Yeah, thank you for your time. We appreciate it.
Thanks for having me on.